call Bill 80, Free Birth Control Act. I recognize the Honourable Member for Dartmouth South.
Thank you, Madam Speaker. I'd like to move second reading of Bill 80. I would like to start by reading not my words, but the words of someone that I respect very much, Dr. Martha Paynter. She's known to this House. She is a professor at the University of New Brunswick and a nurse. And she's also the chair of Wellness Within, which is an organization for health and justice. She says, one of the most significant barriers to reproductive health equity in Nova Scotia and Canada is the cost of contraception. Providing free contraception results in significant cost savings and improvements in population health. Governments save between $7 and $10 for every dollar invested in contraception. And I'll table this in a moment. Madam Speaker, we tabled this bill last year, and it's so important that in fixing healthcare, we address issues around health equity. In the last debate, we heard the member for Richmond talk about working in an integrative health centre that was particularly for urban Indigenous folks in Toronto and how important that was. We know that our health system is anything but equitable. There are some people who have better access than others, and there are some issues that are taken more seriously than others. And in general, and we've heard this in this chamber already, issues that affect women, trans and non-binary folks are lumped in with some others at the bottom of the list. When we were researching this bill around providing free access to contraception, there wasn't actually that much data. Why? Because we don't really study women's health outcomes that much. It's the people who make the funding decisions, the people who make the educational decisions in universities. This is not a core area of focus, but nonetheless, we know from the correlation of age, income, and use of contraceptives, as well as anecdotally from people like Dr. Paynter, how vital access to this is and how closely linked it is to affordability challenges. And I think we would all agree that the two of the main issues facing us in this legislative session, in this moment, are healthcare and affordability. And we believe that this is a bill that touches both of them. Dr. Paynter goes on to say, as a nurse providing abortion care, I see how patients return again and again, because while abortion services are rightly publicly funded, contraception is not, and abortion becomes the only recourse. The cost to Nova Scotia taxpayers of an abortion procedure is roughly $2,000. Compare this to $400 for an intrauterine device that provides effective birth control for 5 years, or $30 for a monthly pack of birth control pills. Contraception is a wise investment. And while I think the disparity of the cost of providing an abortion, a surgical abortion, and the cost of contraceptions speaks for itself, it should be noted that that reduced cost of contraception is still out of reach for many, many women in this province. And, you know, before we introduced this bill, we introduced another bill that created a zone of safety for reproductive health providers, which was passed with support of all parties in this House. And in the debate on that bill, we raised this exact issue, which Dr. Paynter had brought to us. And at that time, the government of the day, now our colleagues in the official opposition, committed to, in fact, the former Premier Stephen McNeil himself committed to looking at this issue and looking at providing IUDs publicly funded access to birth control. That didn't happen, but what did happen was that the Minister of the Status of Women and Community Services at the time committed directly to the Choice Clinic to fund those through the government. So we didn't get it covered with MSI, as is proposed in this bill, but we sort of got it funded through the back door. That funding stopped when this government took over. So I think it's worth noting that we have taken actually a step backward on contraceptive care at the same time that other provinces are taking a giant leap forward. So British Columbia, as many will know, has just announced in their spring budget that they will be providing publicly funded access to birth control for all British Columbians. And we really think that it's time that we follow this model. And I think it's really worth saying that it's not just us, and that in fact, there are so many organizations who are also advocating for this kind of coverage. And we have some in the gallery with us today, and I think they were introduced earlier. So this is the Dalhousie Medical and Government Affairs Advocacy Committee from Dalhousie Medical School. So we thank them for joining us. And I have to confess that sometimes in politics, things work out in interesting ways. Completely independently of us calling this bill, they had started a letter writing and advocacy campaign around our bill. And we only just discovered this yesterday. And so I'll table a sample of this letter, which Minister Thompson will receive many copies of in the days and weeks to come. But essentially, they make the same arguments that we're making here. And I just want to read the closing paragraph of their letter where they say, I believe these changes are a step in the right direction that would increase access to contraceptives, improve health outcomes for our province, reduce stressors on our healthcare system, and foster an environment of care in Nova Scotia that will attract a generation of physicians. So, Madam Speaker, we've talked about how this impacts healthcare. We've talked about how this impacts affordability. We're now hitting on another big piece of what this government has stated is at the core of their mandate, and that's physician recruitment. So in the last debate, we talked about collaborative care, and I think all members of this House acknowledge that this is how physicians want to work. They want to work in collaboration. They want to work together. They also want to work in a system where, as much as possible, people's health needs are met in a sensible and compassionate and efficient way upstream. And so that when they're whatever path they choose to pursue, they have in front of them the people who need to be there. And that population health is actually at the forefront of their minds. And this is a huge step forward. This would be a huge step forward in that. And it's not just our friends in the gallery today, but some other organizations advocating for access to free contraception, you will have heard of these, are the Canadian Pediatric Society, Oxfam Canada, Action for Sexual Health and Rights, formerly known as Planned Parenthood, the Canadian Association of Midwives, the National Aboriginal Council of Midwives, the Canadian Medical Association, and the Society of Obstetrics and Gynecologists of Canada. So that's a pretty exhaustive list, I think, of the people that we choose generally to listen to around health and what we should be doing to act on health. I'll go back to the fact that British Columbia has just done this. So their program is estimated to cost approximately $60 million. That's the projection that they've made. So if we take it on a strict proportional basis of what a program here would cost, that would be about $12 million. I'll remind folks that this government had $1.4 billion, that's a lot of millions, in unexpected revenue this year. And so $12 million almost counts as a rounding error with that much unexpected revenue. And when we have pushed other things in this chamber, we have gotten the response, our focus is on healthcare, our focus is on healthcare, our focus is on healthcare. Our focus is also on healthcare. And we believe that this is a small and relatively inexpensive way to improve health equity, to improve health outcomes, and to improve our ability to attract and retain physicians, particularly young physicians. I think our ability to change, in some ways, the culture of medicine, which we actually should be talking about more in this chamber when we talk about what ails our healthcare. Part of it is that we don't have enough doctors. Part of it is our pay issues, but a lot of it is culture. And we have a new generation of physicians coming in, and they need to be able to conduct business in the way that is consonant with their personal values. And I think that this, from the advocacy that we see from the Dalhousie medical students, this is exactly the kind of thing that they're looking for. The cost of contraceptives, as I said, is a serious barrier for many people. It's an issue that impacts women, trans and non-binary people, low-income people, and younger people. These are the people that would benefit most from a free contraceptive program. I believe my colleague, the member for Halifax, Shabukto, provided a robust definition of what a targeted program is and isn't the other day in this chamber. This is a targeted program. This is a program that is targeted towards all of the people whose healthcare needs tend to be ignored, or many in any case. And so it checks another box for this government. I think I'll just take a moment and note that the status quo is that there are a patchwork of private and public insurance programs, as many will know, and some of them cover some contraception, some of them cover none, some of them cover all, but there are huge gaps. And we know that there aren't that many statistics that we could find provincially, but nationally, 20% of Canadians have inadequate or no drug coverage. That's why this is a part of our push for a pharmacare program more broadly, and a way that this government could lead in efforts towards a national pharmacare program. But 1 in 3 workers have no coverage. It's not just folks who are unemployed. It's that people, by and large, tend to be without coverage here. And, you know, we see the ways that government investment can make such a massive difference in these areas. So again, you know, I'll shout out our federal party who have, you know, pushed for and now brought in a dental care program for all Canadians. And this year, you know, we will have everyone under 18 and over 65 who makes less than $70,000 a year in this province have access to dental care. That's massive. This is a way, this is a step in that same direction to make sure that people just have the access to the basic health care they need, and that money should not be an issue. Access to contraceptive is a reproductive and gender justice issue. It should be treated as a social public health cost. It should not be a cost that is carried by people who are able to get pregnant. I don't need to give a sex ed lesson in this chamber. My kids are getting it now. They're disgusted. They'd be horrified if I was talking about it. But we all have some sense of the various ways in which babies are made, and we all know that there is, you know, that the people who carry the babies are the ones who disproportionately shoulder the burden, the cost, and the responsibility, you know, at conception right through death of the little people that they make. And so this is an equity issue. This proposal is a part of our party's work on advocating for reproductive and menstrual justice. I mentioned our bubble zone legislation. This is connected to our push for greater access to midwifery, free menstrual products, access to reproductive health services, and others. We also, of course, need a national pharmacare program. We need a provincial pharmacare program. But right now, in this chamber, in this House, this government, with this somewhat unprecedented surplus, could do something right now that would make a difference in the lives of so many women, trans, non-binary people, and all Nova Scotians, in fact. And so we urge them to do it. This is healthcare. You said you'd fix it. Pass this bill. Thank you.